When the idea of West Windshores first rolled around, council as a whole was quite supportive of the idea and was thrilled about it. Thessalon is just the fortunate recipient of such a lovely complex.
The community is extremely happy to have access to this piece that was missing, this assisted living senior apartment complex.
So I think it's given us that level of confidence that we have something to offer and an attraction to people.
It's a great feeling that our board has been able to step up and say, you know what, we can do this and we can make a difference in people's lives. And just to have the building stay, to me, that was a big thing. It's a good old building. Don't tear it down.
The building that you see that FARA has purchased and is located in now actually was a building that was built over 40 years ago. So the building could not be adapted for the modern regulations that we have in long-term care. So we did go then to the ministry and say, we are convinced that we need a new building.
Alice was approached by the folks in Thessalon and asked, is there some way we can save this complex?
Our board really took it on, felt that this is what they do. They're here to help people. We had the experience both in housing and in supports.
Part of the project cost was to demolish the former building, except for those areas that were occupied by the Thessalon Hospital and potentially by the nurse practitioners.
That portion of money, we wanted to use it to take apart the interior part of the building because it was all sectioned off into the rooms that had been used for the seniors. And there was a lot of material that had to be torn down out of there. So we finally convinced the ministry that we could do that. We would do that as part of our commitment to the building, but we wouldn't tear it down.
The Ministry of Health was allotting $1 million thereabouts to demolish this place and decommission it. And so with a bit of creativity, they agreed to demolish the interior. And then the Ministry of Housing was ready to come on board and say, okay, so we've got dollars now to build.
We related because that's what everyone thought should happen to the vacated space, but without anybody to take it on as a proponent with the funding and the backing and really with the know-how that FARA has, we weren't really sure how that could be accomplished. But when they came along and had the ability to see what could be done here and had the expertise from their projects in North Bay, it was a perfect fit.
We have a hospital downstairs with an emergency room, nurse practitioner, Meals on Wheels, social worker, home for the aged, close to everyone who needs it.
Looking at putting 33 apartments into a small town was daunting, and we thought, oh, have we picked up too many units? But we're now full. And we pretty much every day have somebody looking for an apartment.
There are a number of people who are looking for a place where they can have some help, some care, and they can't be entirely on their own. They need that social aspect as well.
It's very nice. You got the privacy that you want, and if you want to mingle, you got that choice too, and you're free to go and come as you please.
It was very difficult getting out for me, especially in the winter time. So when this place came available, I thought, well, I don't really need it now, but I may need it in the future. And why not move while I can? So.
We have the two common areas, one on each wing, so that they can go in, they can have coffee, they can have tea, they can do crafts. They can also take those units and use them if they're having a family get-together.
I think it has cemented the idea of the community being that healthcare, health services, and residential hub.
This whole complex really has been very important as far as an economic development as well.
We'd have to thank Alice for really recognizing the need in her and her people at FARA. They just didn't recognize it, they acted on it, they put through the time, the effort, the resources. They really took care of everything, and they filled the void in our healthcare systems.
it's not an easy process, but it can be done, and you just have to sometimes think outside the box. It doesn't fit into the little pockets all the time. Yeah.